Dr. Gonzalez, why have you been so interested in minimally invasive bunion surgery?
It's a great question. I mean, I think that you and I have been on this journey together and becoming experts in the field. We've really seen it grow over the last several years. We've not only learned ways about caring for our patients, but we've also been studying it, as we told you guys before. And I think through our patient experience, through our research, we've really seen that this does provide excellent care for our patients. Fast recovery, less pain, and really good outcomes. And I think as we continue to evolve and grow, we've seen that our patients are happy, which in turn, makes us happy to provide better care for our patients.
Yeah, I agree with you completely. I think the biggest thing that I've noticed about this is how much better patients are doing from a pain standpoint. I mean, I think the patients are getting back to function more quickly, less time off their feet, which is a big inconvenience. I think when you have to be off one of your feet for a few weeks, it's a huge deal. And I think the fact that we've been able to decrease the amount of time folks are off their feet by about a month from what our traditional bunion surgery was has been a really big difference. And just seeing how much better they're doing functionally. I mean, they seem to have more motion of their toe. They seem to have smaller scars and just less pain. Is that what your impression's been?
Yeah, and I totally agree with you. And I think from our patients and the experiences we've heard from them, I mean, we take care of professional athletes, elderly patients, kids, and all of these patients have similar outcomes. They are having less pain, they're recovering faster, they're getting back to their normal shoe wear and their activities faster. And I think as we described to you guys in our educational videos, the minimally invasive surgery, it's much smaller incision, use more advanced equipment, and through that, we've been able to minimize soft tissue pain, lower incisions, and get our patients back to doing what they want to do faster.
I think one of the biggest things that I've heard from patients that have had both types of surgeries is the stitchless surgery. I mean, it's been a huge deal. I mean, the fact that the incisions are so small you don't even need a stitch in it has been a huge deal for my patients. I think that the incisions are smaller, they seem to heal quickly, and the no stitches have been a really big deal for patients, and I've heard a lot of great feedback on that. Have you heard the same thing?
Yeah, I've heard the exact same thing. I mean, people, they can barely see their scars after a couple weeks after surgery. So with shoe wear, it's not rubbing on their skin, they don't notice these big incisions, and that where many people historically don't want bunion surgery because of the pain and the scars, and we just don't see that now, which I think is a real testament to this minimally invasive surgery we're doing.
Yeah, and I think that you've experienced, just like I have, we have a very active patient population that really wants to get back to doing things like sports, activities, hiking, playing tennis, running, all those things. And I think the fact they've been able to get back to doing those things so quickly, I've had so many people comment to me about that. And I think the other thing is shoe wear. So shoe wear's a big deal. And I think the fact that people have been able to get back to wearing any shoe they want to wear, the vast majority of folks has been really, really nice. And it's just very gratifying to see that. I think the other thing that really has separated our institution from others is our team. So, you've heard me say before, and you've said it before, surgery really is a team sport. And I think the fact that we have a great team, whether that's the pre-op folks, to the anesthesia team, to our team in the office, I can't say enough great things about them. They care about patients. They really want to see that folks are doing well, and they get as much satisfaction as you and I do with seeing patients get back to doing all the things that they love to do.
Yeah, we couldn't do this surgery and this procedure and take care of as many patients as we do without our team. And so I think that's one thing that separates us and makes us unique is we're a team, but then it goes through our whole level, our staff in the operating room, in clinic, and we're just a big family here. And that's why we're making these videos today, and that's why we study, we do research together, and we take care of our patients. So, I mean, I think that we could not be here without our team.